بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله اللهم توفقنا مما تحب وترضاه يا رب العالمين. Oh Allah, we ask you to guide us that you love and please with and best for our community and make it easy for us, Ya Rabb al-Alameen. We welcome each and every one of you to this Friday session, Health and Wellness. Inshallah, tonight we're going to be talking about Omicron and the exciting title of Is there an insight? Is there an insight for COVID-19 and particularly the Omicron? So I will start with a little bit of update about where our current situation is, show you a few slides, and then inshallah we'll take a few questions, and we had a few questions that we had, and then we'll address those, and then inshallah we'll take some of your questions, inshallah bin rahman. So with that, I will start it with the first slide, show that let me see if I had, this is a Shelby County caseload, and if you see this solid bar is the average, 7-day average number. So if you can see, there's about almost 4 peaks here, okay? In the beginning, when we started 2019 or at the beginning of 2020, in the first case, and then we kind of hunkered down, and then the cases went down, and then we lose restriction, they came out, and I think there was also the South African variant at that time. And then the second peak, the third peak is the Delta. And the last peak you can see is the Omicron. So one of the things I want you to take away from this slide is that the highest peak you see is Omicron. It's almost twice as high as the Delta. This is the number of cases in Shelby County, okay? And if you look at the United States, it's almost similar. You can superimpose these graphs, okay? So the other thing I want you to take away this is that, alhamdulillah, it looks like we might have peak in the beginning, somewhere in the beginning of the early part of the month, and now it's coming down. It was a high sometimes as 3,000, and now we are down to maybe 1.5. Okay, so you understand that is big, and the peak is very high and it's sharp. Okay, that's one thing I want you to take away of it, and the same with the United States. Okay. This is the daily hospitalization, and you can also see there's several peaks, but the peak of hospitalization for Omicron is also the highest, but it's also the sharpest. Okay. If you look at the death rate, okay, so you see the death rate is the high in the middle, okay, and it's not so high as Omicron at the present time. This is also really not a fair comparison, because after 2 years of dealing with this disease, we developed immunity, we developed vaccination, so there's a lot of protection in the community that now with the Omicron. So that I see may be also one thing that really, and also understand that the death is usually delayed. And it's usually, when you see the case peak, it's about maybe 2 weeks delay on the death itself. All right. So at that point, I then will stop for a minute, and I want you to take away the Omicron or COVID-19 came in waves. Okay. The highest caseload is Omicron. Okay. Hospitalization is high, but the peak seems to be big quickly, and it looked like it's coming down, and maybe that's a good news in that. The other question we wanted to address, and that we want to address it tonight, is about tests, and what kind of tests we have available. What do we do this? How do we do this test? And especially now that the government set up the website that you can go in there and order a test to test yourself. And if you have not done that, please register it, and you can get 4 tests for your family. So I want you to understand there are basically right now maybe 3 tests, but only 2 main tests. The first test, and the most reliable and the most accurate and most sensitive, is PCR. PCR tests the genetic material of the virus. Basically, it says if the virus genetic material, RNA, is it present in your nose, in your mouth, or wherever, saliva, or wherever the test was taken. One thing I want to take, sometimes it's frustrating when we do the PCR because it takes time, usually 24 hours. When I want you to take it away from it, it's a really, really very involved process. It is actually, when you listen to it, it's a marvel of science. You take the virus, you break it down, you get the DNA or RNA in this case, and then you beautify it, and then you change it to DNA, and then you amplify that 1,000,000 times so you can get the signal. And all of those requires technicians and expertise, and also specialized machines, very specialized machines. So that's why when you do the PCR, it takes at least 24 hours or so. So please understand, it is a really, really a marvel of medicine. But it's the most accurate, it's the most sensitive test, okay? But that also says sometimes is that it may be positive and remain positive for several weeks. Okay, so that's why we don't usually do to see if you are over the disease, but you test it to see if you have the disease or not. That's number one. Okay, the second test I want you to understand is now what's called rapid test. The rapid test, it tests an antigen, okay, or a surface protein of the virus. So both these tests are testing the same. Do you have the virus, yes or no? This test is the antigen or a protein, okay? And it's a simple, and you can do it at home, okay? But this test is less accurate, less sensitive. It's the best to use when you have a high viral load. So in the beginning, in the first 1 or 2, 3 days, you might not have enough virus in your system, so the test may be negative. It is so that's the one is the best use when the virus is high. This test shines to see the people who have high viral load. So if you, for example, that you want to know you are going in a gathering and you want to know if you have COVID, if you want to see your grandparents and you see if you have a COVID test, then this is the test to take. It may not be as sensitive and as accurate as PCR, but if you have a very high load, viral load, it will tell you if you are positive or not. If you are positive, then you can take precautions. So this test is not the test you normally use when you have symptoms to find out if you have a COVID or not. At that time, we recommended that you take the PCR, the most sensitive, the most accurate. This is the test that when you have a family gathering or you are going to work or you are doing these things and you want to test, especially those who have not been vaccinated or those may not have a good immunity, things like that. You worry about they may be carrying the disease and want to spread to others. You want to give this test, see if they are positive or not. Okay. It is a simple test. It's what I call the pregnancy test of COVID-19. You take this, you swipe it, you drop it, and then you get this two lines. If you have 2 lines, you are positive. If you have 1 line, you are negative. C is for control, T is for test. All right? So you can see the C or the C. So it's a simple, as I said, but it's a less accurate. All right? And it's a good when you have a virus test. So with that, I think I would turn it over to Dr. Zaman, and we'll go to the next question about the test. So now we're going to talk about what are the recommendations for mask, distancing during event, congregations and gatherings, family visits, and during this Omicron surge. So Dr. Zaman, what do we do with these gatherings and how do we proceed?
Okay. Bismillahirrahmanirrahim. Alhamdulillah. Salatu wassalamu ala Rasulullah. So question, we are people of communal ummah, and we like to gather, and we always have gatherings like nikah, walima, aqiqah, and we celebrate sometime graduation of our children and achievements and fundraising and Muslims in Memphis festival, all types of events we have been sacrificing for a full 2 years. So I want to bring you an experiment that just came out. It addresses a question that we have been kind of trying to sort out, and I think we have a clear answer you'll see in a minute. So I'm going to take an example to all of you and say, let's say we have a nikah in the banquet hall, MIC banquet hall, 300 visitors invited, guests invited, and they came and they witnessed the process of a wedding in Islam, and then food was served and they took their mask off and they started talking, and they enjoyed the food, they enjoyed the companionship, and they went home. And in this example, one person was positive, but no one knew what the person is. So we're going to ask some questions as to what does talking has to do. When we started in 2020, and we call this a respiratory virus like influenza and tuberculosis, that spread by droplet nucleus, meaning droplets are ejected when you cough, when you sing, when you speak loudly or sneezes. And we said these droplets are large enough to suspend in the air and drop down about 3 feet distance from the source. And we say multiply by 3, make it a 6 feet, so that's where the 6 feet came from, right? At that time, we were not quite sure about aerosol transmission. Means can there be particles generated in the ordinary speech or ordinary breathing or resting breathing? And can these finer particles called aerosols move further out than 3 feet, 6 feet? And can they infect people? So I'm going to ask you the question of the various level of vocalization. We can say that heavy breathing, as in strenuous exercise, will be considered the highest force that you generate in your exhalation, and that will be the highest likelihood of aerosolizing respiratory droplets. Then shouting or loudly speaking. And we speak loud in our weddings because people are talking and everybody is talking, and you want to be heard, and you are on a table, across the table, you want to be able to be heard. So since everybody talking, you raise your voice so you can be heard. And sometimes there may be a nasheed, somebody's song, and then normal speaking. And the last thing is silent, right? So if you were to come and pray here, everyone came quiet with their mask, and the Quran was recited by the Imam, and you listened, and you finished your prayer and you went home. So this scenario may explain, and I'm going to come to it, how our prayer in the masjid has been so safe. So if I ask you, if in this example of a theater where people are brought to a theater and they were given a choice on one situation not to talk, no one spoke, watch the movie, and that was done for an hour and a half to 2 hours. And then another day, they were asked to speak freely while the show is in progress, right? So when they did not speak, only 14% got infected from one cause. But when they spoke in a movie theater, 54% got infected. And in this scenario, they were not necessarily coughing or hyperventilating, basically speaking to someone next, watching a movie, maybe relating to what's going on. So you can say 14% became 54%, right? In another scenario, the same event, mask was used, and then the mask was removed, and they watched the movie for an hour and a half. 24% got infected without the mask, 4% got infected with the mask. So it's 5 times higher. 5% got infected when they used the mask, and 24% got infected when they did not. And then they changed the ventilation of the room, air circulation. And when the air circulation reached a standard, HEPA standard, OSHA standard, the infection rate was 17%, and when the ventilation was poor, circulation was reduced, it was 67% got infected. And lastly, heavy exercise. This was a different experiment, such as in a gym. 99% people got infected from one source in a setting of a large gym room where everybody was breathing. So what I take from this is that we did not consider normal speech in 2020 as a way of transmitting the coronavirus. We were talking from tuberculosis experience going back 100 and more years. and we thought it is only a droplet that transmits the virus. But now we know that Omicron in particular transmits to aerosolization and sometimes can go 50 feet across in the air. So my advice on this point is that when you get invited, gracefully regret if the community spread is high. If you go to a place, keep the mask. If you have to attend an event because of social obligation, consider keeping yourself quiet. I don't know how, but you can reject it, or you can attend and not speak, keep the mask on. And you can also consider distancing like we do. So of the mask we have a slide there. We have 4 kinds of masks. One of them is not considered reliable cloth mask and not recommended. Omicron seems to pass through the layers of the cloth mask. Unless it is a 5-layer cloth mask, is not recommended. So N95 gets the highest grading, followed by the KN95, which is the Asian version of N95, which you can strap around the ears instead of going behind the head and neck. And then you have the surgical mask. So surgical mask comes in 3 or 5 layers. The more the layers, the better it is, and you can know it if you press it, stretch it. This is our MIC mask. I can see the layers when I stretch the mask, right? Stretch the mask, you'll see the layers. So summary, masks are very beneficial. Any mask is better than no mask at all, but the cloth mask may not be protecting us anymore with the virus that is highly concentrated around the nose, nasal passages, and upper aerodigestive tract. It may escape through the layers of the cloth mask. So N95 is better for better protection. KN95 is good, especially those made in South Korea. I'm told South Koreans are more authentic. And then surgical mask will be the next with 3 to 5 layers. So this is the recommendation for masking. I mentioned a little bit about gathering and also family visitations. Again, at this time, we will say caution is due, right? Until we see, inshallah, the drop in the cases and reduction in the number of transmission. So that's the short answer of that long question. Thanks.
So, Jazakallah khair, Dr. Zaman. One thing that you have to understand, there's 3 main things. Number 1 is vaccination. Number 2 is masking. And number 3 is testing. So when you have especially these gatherings, we recommend that at least you have 2 of these. So test yourself before and wear a mask if you can. And if you are vaccinated and boosted, is better. If you have all 3, it's the best protection. So you test yourself, everybody is negative. Everybody is vaccinated and boosted. And everybody is wearing a mask. That is the best gathering and the safest gathering. Okay? If you have at least, you need to have at least 2 of these. Okay? So that's good. Jazakallah khair, Dr. Zaman. So another question, Dr. Zaman, is that if one of us tests positive, let's say we talk about this test positive and things like that, what are treatment options do we have at this point for Omicron or all the COVID-19?
Yeah, let me give you an example. Children are getting infected, and there is no question when a child gets sick and dies, it's a tragedy. 1,100 children has passed away. But if I told you that the risk of death in children is about 1 in 630. For every 630 adults, 1 children has died, even though children make up 22% of the population. So 1 of 5 of us are 18 years or younger. 1 of 5 of the population in this country, 22% are children, but they, in terms of lethal outcome, suffer 1 in 650. So you can imagine it's a much less riskier situation. I give this as an example to this question because one of the most important points that often is missed in our conversation is we always talk about the virus, but we don't talk as much about the host. It is not same as someone above 65, someone above 85. Today they published the British data, British Registry of Death. They did something very interesting. They looked at death certificate mentioning COVID-19 as the only cause of death, and no mention of hypertension, coronary artery disease, chronic lung disease, chronic kidney disease, cancer, immunosuppressive disease, etc. So when they looked at only cause of death mentioned as COVID, they found out that about only 20% of the total death could be attributed to that group, right? And then they looked at the number of people died in England and their average age. Can anybody guess what was the age of the people that died? Average age. You know, average is you add 150, divide by 2, and you get 75, right? So you add up all the ages, it was 82 years. So I'm bringing this point to say that be mindful that is a disease of the extreme age, particularly when it comes to lethal outcome. Lethal outcome. Even life expectancy in England is not 82. But when you take about the people who died from COVID, the vast majority of them are very, very elderly. Then comes the risk factor we mentioned, right? You talk about comorbid illnesses, chronic heart disease, chronic lung disease, kidney disease, stroke, and you have your immunosuppressive illnesses on immunosuppressive therapy. So the first thing I will look if somebody is positive, is this a child, young person, healthy, or this is a senior citizen, plus has more than one COVID-related comorbid illnesses. And this is why we call it health and wellness, this program, right? We have been emphasizing the health plays a big role. Age you cannot change, but conditions like obesity, right? And hypertension and heart disease and lung disease and kidney disease and stroke and cerebrovascular disease, as well as many of the cancers are behavioral and modifiable risk factors. So if you look at those factors, then you decide if it is a high-risk person. Now there are 2 emergency used authorization medication. We mentioned it last time. I have 2 slides on it, if I can look at the slides. One of them is from Pfizer, and is a combination of 2 medication called Paxlovid. It is available under emergency authorization, is available in local pharmacies. Supply is limited, production is slow. It has been a difficult molecule to put it together. So I think it's coming and is available free of charge. Private insurance will cover it. And the second medication that came up, all of them late last year, is from Merck, called Molnupiravir. So these medications are medications similar to Tamiflu or Teraflu, which when used in the first 5 days of illness, right? Somebody turned positive and has fever or sore throat, and you are on day 1 or day 2 or day 3 or day 4 or day 5, if these medications are taken for 5 days, Molnupiravir, you have to take 4 tablets every 12 hours for 5 days, and you need to complete the course. And the Paxlovid is taken 3 tablets twice a day for 5 days. And this medication can reduce your chance. Now, the Pfizer medication can reduce your chance by 90% from going to hospital, getting severe disease, Paxlovid, and the Merck medication can reduce your chance by about 30 to 50% from progressing to severe disease. So I say the most important message is that there are treatment available. If a senior citizen in the house, a mom, a grandma, a father, mother, aunt, somebody living with you, and you went to work and you bought the infection not knowing, because you may not know about it, right? And a senior person got infected, you have some hope now that you can prevent the patient from going into hospital, getting severe disease. With this medication, one is more effective than other. They have significant side effect. It will take some time to know how safe they are. Studies and trials are different than real life experience. So in terms of knowing what disease you can take, what are the conditions where you cannot take it, antiarrhythmic drug, and you have medications that are taken for arrhythmia, I mentioned, they can interact with this medication. Pregnant patient cannot take Molnupiravir. And there are multiple renal failure patient cannot take Paxlovid. So I would say consult the physician. These are prescription medication. So there are more than one medication. In addition to rest and zinc and vitamin D and melatonin and enough sleep, isolate yourself in a room, open the window, get the ventilation going, use room air filter or room air circulator. All these precautions that we have been talking for 2 years are still applicable, but there are 2 medications that are available to prevent severe disease, and I think we may be able to find benefit from them.
Jazakallahu khair, Dr. Zaman. A couple of items we want to emphasize is that number 1, if somebody in the family becomes positive, what do you do with the rest? How do you address this? So what we're recommending at this point is that And CDC issue a guidelines. Okay, so if the person comes positive, then you have to isolate yourself at least 5 days. After 5 days, if you don't have any symptoms or your symptoms are improving significantly and you don't have any fever, then you can come out of isolation, but you still have to wear a mask, preferably like K95 or so when you are around people. Okay? If you have a multiple, and then you have to test everybody in the family, because if everybody already positive, then there's really no need to isolate it. It becomes complicated and difficult if there's a child is positive who takes care of it. We recommended that, the most healthiest adult, that he doesn't have the comorbidities, Dr. Zaman, who is also already vaccinated and boosted, take care of that child and things like that. So you have to protect the weak, the person who have a high risk for severe disease, the ones who are elderly, the ones who have comorbidities, the ones who for whatever reason cannot take the immunization on things like that. Those need to be protected. And even if you have a gathering, okay, and there's a little kids who cannot get into vaccination, we prefer that those young kids are around the adults who are vaccinated, okay, and don't have comorbidities and can have a good immune response, not the elderly ones who don't produce strong immunity to the, inshallah, bin Rahman. With that, inshallah, we'll move to the next question. What is the role of COVID-19? I think we talk about the COVID-19 vaccine. What is the role of COVID-19 vaccinations anymore? Will the Omicron surge is building immunity in so many people? So what is the role of COVID-19 vaccine anymore while Omicron surge is building immunity, natural immunity in so many people? Dr. Zaman.
So as we said, oftentimes it has been stated that Omicron is the vaccine of the unvaccinated, right? You all have heard that. And have you all heard about the story of the Czech singer? It's a celebrity, young lady in her 30s, who did not want to take the vaccine. And she found out that her husband and her son is positive. So they came home and she deliberately exposed herself to her husband and son in the course of the few days and became positive. Her goal was, if I become positive, I will get immunity and I don't have to take the vaccine, because she's an anti-vax person. And she is a very popular celebrity in Czechoslovakia, right? And in about day 3 or 4, she dropped dead. And I give the example to illustrate that, yes, Omicron is less severe. Omicron causes less hospitalization, less number of people on life support, much fewer, and we still don't know the exact number, people are dying from Omicron. But in last 48 hours, we lost 2 patients in our ICU from COVID. And I am covering this weekend, I'll be seeing 6 patients tomorrow, 2 of them on life support, and their condition is not looking that good. So it's not without risk, right? So vaccine causing death is very, very, very rare, right? So in a scientific perspective, we still have to say that your risk from a vaccine is much less than your risk from Omicron infection. Even though you may be younger, you may not have any high risk factor for progression of disease, but like this Czech singer in their 30s, and we have heard children, you don't know. Exceptions are out there. So I would say our recommendation remains for vaccination. Boosting, if you had 2 doses, without the 3rd boosting dose, protection is not good, especially if you had the last 2nd dose 6 months ago. So if you are boosted within 6 months with the 3rd dose, protection is 67% even from Omicron, even though the protection is less because Omicron can evade the immune system, but the protection is still 2 out of 3. And protection from severe disease and protection from life support and death is even much more unvaccinated than non-vaccinated. So that's a short answer for that question.
Jazakallah khair. So it is clear and it's been unanimously agreed, the vaccinations protect against severe disease. So we are strongly recommending that everybody who can get vaccinated, okay? To protect yourself and to protect your family, okay? Omicron, it is by far right now the most virulent or the virus that spreads the fastest than we ever seen before. Measles used to be the fastest and most virulent, that if you are in a sports stadium and somebody in the middle of the section had a measles, almost that whole section get a measles. Okay? Omicron is that invasive or that virulent. Okay? So if somebody in the family gets it, the chances that everybody in the family is going to get it. So please take precautions and the protection that Allah gives you an opportunity to take advantage of it. Okay? Those who don't have any other choice and don't have vaccinations, and yes, Omicron, alhamdulillah, we thank Allah that Omicron is not, imagine if Omicron was deadly and was spreading this. This is a blessing from Allah. So understand this, okay? Especially for the poor country that don't have any vaccinations, okay? Like in South Africa, that where the rate of vaccination is only 20% or 25% or less. So we'll move into maybe our close to the end, is that, Dr. Zaman, what to expect of this pandemic now? What is it? What do we in 2020? What happens from here? Do we end? Do we continue masking? Do we take the mask off? What is the next?
So this was the purpose or title of our presentation tonight, is there light at the end, right? So I try to go back to the history and look at pandemics, and the most notable one is the 1918 influenza pandemic, and it lasted about 18 months and then faded away. Now, we didn't have that time test for viral resistance and mutation. This is 100 years ago. The technology, of course, there. PCR came just 30 years ago, 25, 30 years ago. By the way, PCR was given Nobel Prize for medicine. This is such a remarkable technology. I was in my residency year, I still remember. So going back to history, influenza, Spanish flu, so-called Spanish flu lasted about 18 months. Historically, pandemic seems to run its course with surges and waves and appears to fade away between 2 to 3 years. Most viral pandemic lasts 2 to 3 years. We have just finished our second anniversary. So that's one reason for hope, right? And then what Ibrahim brought up is that there are multiple things that are blessings in disguise for Omicron. One is it is less pathogenic, less virulent, meaning it causes less severe disease. I think Ibrahim meant contagious, right? Contagious. It is very contagious, but if we say severity of disease, pathogenicity is less, as we know, fewer percentage are progressing to hospital admission or life support or even death. So, other news which is remarkable, in matter of 2 to 3 weeks, is completely displaced the Delta. It's like one walked in, the other was pushed out, right? Delta was displaced by Omicron. So a much more virulent disease was displaced by a much less severe disease. And if today, in the last 7 days, last week, Shelby County was recording 3,000 cases a day. And if we say up to 10, 20% will land in hospital, there will be no place in any hospital for those people. And this is the blessing. There will be deaths on the street, deaths outside the emergency room, and deaths in people's house without oxygen, suffocation, basically. So Allah's blessing, this came as a less serious, less severe disease that allowed us, although the hospital system has been strained, healthcare workers have lost 20% of the workforce, ICUs are full, emergency rooms have large waiting patient getting to the inpatient beds, etc. It is also conferring immunity against Delta. So not only it is giving an immunity in general, but if you take the serum from a survivor of Omicron and put in a tube with Delta, it neutralizes those viruses. So it has immunity against Delta and possibly other strains, which may evolve in future. And this is another blessing, right? So this is another piece of information that might help us developing community level immunity. The other thing is very short lasting. It comes out like a hurricane and is gone. 6 weeks, 4 to 6 weeks. The first case of South Africa was announced in November 24, right? Ibrahim, today is December 21st, January 21st. So 8 weeks ago is almost gone from South Africa. 95% people in South Africa are positive antibody. About 95% in England are positive antibody, right? So those countries which has gone almost through the surge are showing very high level of immunity. Of course, South Africa vaccination rate was very low, but the European vaccination rate is higher than the United States vaccination. Those of you probably know that we rank less than 50th in rate of vaccination in the world. You know, United Arab Emirates is number 1 in the world. United Arab Emirates has 98.5% vaccination rate. And several countries in Europe and some countries in Latin America also ranking very high. So this country vaccination rate is behind us. So it is producing a wall of immunity across the globe. Bangladesh could not probably produce and distribute potent vaccination for 168 million people. But Omicron just showed up in Asia and Latin America this week, right? It started in South Africa, spread to Europe. It has showed up in Asia and in Latin America, and is likely is going to be a very, very crisis time with resource-poor nations. But if the disease is not as severe as South Africa experience shows, most people should become naturally immunized, plus vaccination immunity should put us above the herd immunity that we have been talking about for a year and a half. So I mentioned so many factors, right? It is very contagious, but it's also less severe disease producing. It doesn't kill as many percentage-wise. It does produce immunity. It has displaced the Delta. It seems to protect from other strains. And it appears that its course is very short and rapidly running. So the difficulties will not be learning. Delta is about 3 times more longer in its spike, in its surge timeline than Omicron. So with all this putting together, epidemiologists in Europe and healthcare expert and public health expert are very, very optimistic that this is the end of the pandemic. But in this country, they are not so optimistic because it is a very heterogeneous nation with so much political, social, ideological challenges that we have seen when the vaccine came and is made available, people didn't take it. Children, just only 1/3 of the children who has been given vaccine approval, they don't take it. So the percentage of children vaccinated remains minority. So we don't know what will happen in this country. For me, I inshallah hope and pray that this is the end, but Allah subhanahu wa ta'ala knows best.
Jazakallah khair, Zaman. So I think that a lot of people agree this is right now we are moving away from pandemic phase, inshallah, bin Rahman, maybe moving toward endemic phase. But that endemic phase may be that it may mean that we're still gonna accept a significant level of death from Omicron. But alhamdulillah, if we continue to have these medications, and these medications like Pfizer, if they prove to be as effective as they say they are, okay, it is very, very good. And actually, it's much more effective than Tamiflu for flu and things like that. But again, we have the flu, which is endemic, and we lose around 30,000 people almost every day, every year. I mean, not every day, every year. So is Omicron going to move to that phase? Understand that we have some level of immunity from natural infections, from vaccinations. Even now in the United States, almost 75% of our adults right now are vaccinated. Agree, especially those of us live in the South. Our rate is not that high. And especially, alhamdulillah, in our community, when we did the survey, even like almost a year ago, we were close to 75% or higher. So alhamdulillah Rabbil Alameen, there is some level of immunity. So the question in Dr. Zaman, are we going to be wearing masks 3 months from now, 6 months from now? What was your general gut prediction and feeling?
You know, I think mask is good for many things that we just realized. Last year I did gardening all summer and all spring. And my brother Isam is there. He knows what we have in common. Breathing issues. So I did not have any problem. It effectively shielded me from the soil fungi and allergen and pollen. And inshallah, mask is good.
And the flu disappeared too, right?
Yeah.
We had the lowest flu
season.
No, lowest flu season last year.
Lowest flu season last year. Inshallah, this will be hopefully the same this year.
Yeah.
So yes, I think for a foreseeable future with pandemic becoming endemic, and not knowing where it will rise, right? You go to a party or in nikah, and that is where the endemic spark came out. You never knew, right?
Right.
One person was harboring the virus,
Yes.
partially immunized, so did not have symptom,
Right.
and started mixing and matching and socializing. And so I'm for mask. I
So,
think it's good for health. Yeah, you don't have to breathe cold air, Brother
Yeah,
Islam.
yes, exactly. But inshallah, bin Rahman, we look forward to the days that we gather without mask,
Okay.
without social distancing, and inshallah, bin Rahman. With that, we'll wrap it up. Dr. Zaman, any last comments?
No, I just wanted to, we come on and off, and information is everywhere. You don't need us to tell what we just told, but we feel there is a personal touch, inshallah, in our connectedness to our community, to our brothers and sisters.
Yeah.
I know I remind myself of Sister Lamia Hajje, who has been 5 months plus on mechanical ventilation. Young sister, 40 or less, and every single day for her family, Tragedy, make dua. And I lost my brother early in the ending. We lost an aunt in Memphis. And how many people have left the earth, right? So I would just say be empathic, sympathetic, make dua for your fellow, ummah and brothers and sisters, and make dua for your family. Keep your guard up, stay healthy. This is one thing we're doing here. Ibrahim started wellness and health. If you, inshallah, stay physically active, your body will tolerate this kind of insult better, right? So many of the diseases are disease behavior. So inshallah, we ask Allah to protect our community.
Yes.
And we will continue to try to bring information that we think are important to you all. I think there may be some question, Ibrahim, online or Hasnain has. We can fill them.
Okay, they will come back to us if we have something, inshallah. But I agree, Dr. Zaman said, please, the health is one of the most precious gift that Allah gives us. And the best way to thank Allah is for what He gives us is to take care of it and utilize it. If you understand the people who die from COVID-19, okay, more than 70% of them were overweight. More than 40% of them had diabetes. So please, take care of, and if you have a diabetes and you take care of it, your risk goes way down. Okay, so you might have diabetes, but not all diabetes are equal. If diabetes is uncontrolled, it's a completely different animal than if the diabetes is controlled and treated well. Inshallah, with that.
Hasnain, any question there?
But Islam has a question.
Local brothers here has any question?
You mentioned earlier that if a member of the family tests positive, that the rest of the family, it's recommended that be quarantined. Is that true?
If a member of the family is test positive, okay, we recommend it that the rest of the family get tested. So you know who is positive and who is negative. And let's say if the rest of the family is negative, then you isolate that individual. Okay? But if everybody else in the family is positive, everybody is positive, then most likely that you have the same strain. It doesn't unlikely that you're going to get different strains. So then there's no point of isolating. You see what I mean?
So the rest of the family, even if they tested negative, they can go on with their normal life?
They can go as so see, this is a very, very good question. So what he's recommending is this. Okay, so right now the CDC has a different recommendation. So let's say what happened if you exposed to somebody who has a COVID-19. So the CDC says that if you are fully immunized and boosted, okay, you don't have to isolate. You can wear a mask, okay, and go out, okay? But you have to monitor your symptoms, okay? All right? And they recommend it in 5 days just to make sure you test it, okay? All right? This is good. If you are not boosted, you're vaccinated, but you're not boosted, something like that, they will recommend it that you get isolated yourself if you are exposed. So if the family exposed to you, they are negative, they need to quarantine. There's a difference between quarantine and isolation. They need to be quarantined, okay? They don't go to work, to school, okay? And then 5 days later, they get tested, okay? So it is a little bit of leeway for people who are fully vaccinated and boosted according to CDC guidelines if you are exposed, okay? And as long as you wear a mask around people, you don't have to be isolated. So that's a little twisted, but it's a neon. You have to be, if you're exposed, you have to, it used to be like you quarantine for 2 weeks. That 2 weeks now reduced to 10 days, 5
The reason I'm asking this question, I'll be very honest with you. When a kid at school is tested positive, they send in their siblings home, even though the siblings were tested negative. So I don't understand why they do it.
So,
That's one thing. But then a teacher at school, her son was tested positive, but then she took the 2 other kids and herself to school. So I asked the administration why they said we needed her. To me, it looks like if you send the other kids, that's kind of sending the wrong message.
yeah.
That's what I'm trying to get to.
So, yeah, Ibrahim was saying
It hasn't changed now, the CDC.
the guidance changed because asymptomatic people can return in 5 days with a negative test. That's the shortest you can do, right? If you have no symptom and you were positive and in day 3 or day 4 you started getting better and you took a test on day 3 or 4 or 5 and it's negative, you can return if you had no symptom. If you had symptom, the story changes a little bit.
Yeah.
It goes to 7 or 10 days.
But also,
But that decision that you mentioned is the school issue is, of
Yes,
course,
yeah.
practical, logistic, I think.
yeah, but also, Brother Sam, understand, right now, and the CDC get criticized for, reducing the time from 10 days to 5 days and all these things like that. But we realize, I show you how high the peak for Omicron is. So even in California, they said to some of the hospitals, they say, tell to the staff, even if you are positive, come to work, because there's no. Okay. So even our hospitals, they said, okay, if you get to the critical level, okay, you people have to work. So there are contingency, to if you don't have anybody running the ICU. So there are levels of contingency, just so-called essential workers. Okay, so
Teachers may be that category.
So that is a little bit of leeway in that. But the ideal thing, if you have the option that you are exposed to somebody who is COVID positive, it's better to quarantine for 5 days, test for 5 days, and then if you are negative, then you can go out with the mask, inshallah. All right, inshallah, with that, we will wrap it up, inshallah. Jazakallah al-khair, Dr. Zaman. You are on call this weekend and you took the time to share your experience with us, inshallah, bidn rahman. We ask Allah subhanahu wa ta'ala to protect our community, and thank you for your time. Jazakumullah khair. Wassalamu alaikum wa rahmatullahi wa barakatuh.